Don't you just hate how much money you have to spend at the dentist? God, these dental bills keep piling up. And even if you have insurance, it really doesn't matter if you have a really big treatment plan. A lot of insurance companies will max out at like $1,000. Sometimes that's not even enough to save one tooth. And if you have 20 other teeth that you need to save, all of that's going to be out of pocket. So I'm going to talk about ways you can actually save money at your dental visits, but still keep a healthy mouth. So the first set of tips I have revolves around preventive care, because the number one way to save money in dentistry is prevention. So this means all the routine things that you're supposed to be doing. Going to the dentist every 6 months, getting your teeth cleaned, getting your x-rays and your exams done, but also doing all the right things at home, like brushing and flossing. Preventing dental issues in the first place is the best way to save money. So this is easy for people that have insurance, because a lot of times insurance companies will cover their x-rays, their exams, and their cleanings for the whole year. But let's say you don't have insurance. Yeah, those 2 cleanings and an exam might seem like a lot of money to spend every single year, especially if you don't really have that many problems that often. But this is the way that you're gonna save money. Think of it like a small investment every year to make sure that you don't have to spend a large amount of money later on. At your cleanings, you're cleaning away all the plaque and tartar that build up on your teeth. So normally when you brush at home, you're cleaning away this loose biofilm of bacteria on your teeth, and this is called plaque. But over time, this biofilm of bacteria will harden and turn into tartar, and this cannot be cleaned away at home. So when you go for your cleaning, this is what's getting scraped away and cleaned off to make your teeth look nice and shiny. If this isn't cleaned away, then over time it's going to cause more and more inflammation in your gums. And this can lead to things like gum disease and gingivitis. And if this gets worse, it can even start to affect the bones that support your teeth and lead to bone loss and lead to your teeth being more loose. This is a condition called periodontitis. And if this happens, it's irreversible. Whatever bone loss that you get cannot be gained back. So you want to make sure you stay on top of this. And also when you go to the dentist every 6 months, you detect things a lot earlier than if you were to wait a few years. Like for example, if a cavity is just starting off. A lot of times when you take x-rays, we can look in between the teeth and see if you have a cavity or not. But sometimes we have like an in-between lesion. It's called an incipient lesion. This is when you have a cavity that's starting, but it hasn't broken through your enamel yet. Your enamel is the outer layer of your tooth. If we see a cavity that's starting off in your x-ray, but it hasn't gotten into the dentin or the inner layer of your tooth yet, then we can still reverse this. We don't have to do a filling. The best ways to prevent here would be sometimes doing a fluoride treatment, which is literally painting this fluoride varnish over your teeth, because the fluoride can help remineralize and strengthen your teeth. And also regular brushing and flossing at home will help remineralize this area. But you would only know about a small lesion like this that's just starting off if you're going to the dentist like you're supposed to. If you keep neglecting it and go like every 5 years or so, those 5 years can make a really big difference. So if you have something that's just starting off and then you take the measures to fix it now, then you can probably prevent even ever getting a filling. But if you have something that's starting off and then you wait 5 years, this can turn to a whole different situation that will cost a lot more money. Also, if you do have a cavity and end up needing a filling, doing a filling is still a lot cheaper than if this cavity gets too big and now you might need something called a crown or even a root canal and a crown. These two things are significantly more money than doing a single filling. So whatever the case is in dentistry, the earlier you detect something and the earlier you treat something, the better. Now when it comes to keeping your teeth clean at home, some simple tips are, one, I'd recommend using an electric toothbrush. An electric toothbrush makes it a lot easier because all you have to do is just hold that toothbrush against every single surface of your tooth. You want to make sure that you're cleaning every single surface of your tooth evenly. So sometimes people will neglect certain areas. And this is another thing where if you go to your dentist every 6 months and get your teeth cleaned, they can tell you some areas that you're neglecting so you can focus on those next time too. It's also important to angle your toothbrush at a 45-degree angle so that you're also getting the tooth structure right by your gum line, because sometimes you might get the majority of your tooth, but as your tooth approaches your gum line, your tooth kind of curves in a little bit. So it's really important to angle your toothbrush to make sure you're getting that curvature as well. And when you're flossing, it's really important to do a method called C-shaped flossing. A lot of people, when they floss, they just go straight up and down around all their teeth. Yeah, that's better than doing nothing, but you're still missing a lot of the tooth structure. When you floss, you want to kind of curve that floss around your tooth into a C shape. And then you want to go up and down a few times and even get underneath your gums a little bit. This is the proper way to floss. And then you'll turn that floss over to the next tooth, turn it into another C shape, and then go up and down from there, and do that with every single surface of your teeth. And I get a lot of questions about mouthwash as well. I usually don't recommend mouthwash unless you really need it. Like if you really want to reverse cavities, you can use a fluoride mouthwash on top of your regimen, or if you really want to help reverse your gum disease, then you can try using an antibacterial mouthwash. But in general, brushing and flossing and going to your dentist every 6 months is enough. Now, the second part of preventing dental issues, aside from doing all the things at home, involves a healthier diet. And this is really important because your diet is the #1 cause of cavities, even more than a lack of oral hygiene. So obviously we know that we need to avoid sugar because sugar can lead to dental problems and cavities. But it's really more than that because any carbohydrate, especially starchy and refined grains, will cause cavities just the same as sugar. Because you have this bacteria in your mouth called Streptococcus mutans, and these bacteria will eat these carbohydrates and these sugars, and they'll release lactic acid as a byproduct. This lactic acid is actually what's causing those holes in your teeth and causing those cavities, because that acid will sit on your teeth and demineralize your teeth and weaken them until a hole is formed. And then once you get a hole, then these bacteria can go deeper inside the tooth and keep spreading and causing mayhem. And some foods, even though they're carbs, are going to be worse than others, especially stickier foods. So foods like those candies or caramel or something that will actually stick to your teeth will be much worse than a chocolate bar or something that you can eat and quickly wash away, because as it's stuck to your tooth, and even if you like rinse with water or something, it's still staying around there, that's going to be constantly feeding those bacteria, which will lead to more and more of that lactic acid and potentially to another cavity. Versus if you eat something sweet or sugary, but then it goes away pretty quickly, now you're giving your saliva time to build up and buffer out that pH, and also you're limiting the amount of bacteria that's going to be eating those sugars. Now, foods that you want to include in your diet are going to be a lot of fruits and vegetables. When it comes to these specifically for your teeth, the crunchier is going to be the better. So for vegetables, things like lettuce, spinach, broccoli, celery, and carrots, all of these are crunchy, they have a lot of water in them. So just the crunchiness in them and the water kind of acts like a natural toothbrush, because it's going to be scrubbing your teeth and the water is going to be washing away any of the plaque and bacteria and also buffering out that pH. And carrots specifically are really good because they have a lot of beta carotene, which is converted into vitamin A in the body. And you need your vitamins, including vitamin A, for healthy gums and healthy teeth. And you get a lot of that from carrots. Spinach is also a great source of calcium, which is really important for teeth because it actually helps remineralize the teeth. Your teeth are made up of these hydroxyapatite crystals, which have the really big chemical structure, but two of the main components are calcium and phosphorus. So you need to have enough of these minerals to make sure you can adequately remineralize your teeth. And a lot of these vegetables are also a really good source of vitamin C, which we also know is really important for your teeth and gums. You might have heard of a condition called scurvy, which comes from a vitamin C deficiency. Scurvy is characterized by a lot of bleeding gums and a lot of gum infections and a lot of damaged teeth. Because vitamin C is really important for proper wound healing and for collagen as well. So if you don't have enough of this, then your gums aren't going to be able to repair themselves as well. Now when it comes to fruits, really any fruits are going to be good, but some of my favorites are going to be apples, strawberries, raspberries, oranges, and kiwis. These fruits have a lot of fiber, and some of them even will have that scrubbing action again. So as you eat them, for example, like an apple, it's really good for scrubbing and keeping your teeth clean. And some of these fruits also have xylitol. Now, xylitol is really cool because it's a sugar alcohol, but it's the only sugar alternative that actually prevents cavities. It's an antibacterial. Every other sugar alcohol, like when you have your sugar-free gum, if you have like sorbitol or something in there, those can actually still cause cavities. It's very, very rare, and it's really hard for the bacteria in your mouth to digest those sugar alcohols, but it can still technically cause cavities. Now, xylitol, on the other hand, is the only one that not only doesn't cause cavities, it actively prevents cavities. So even if you're looking for like a chewing gum or something like that, look for something that has xylitol as a main ingredient. Now you might be worried about the sugar that's in fruits. Like, isn't this sugar going to cause cavities? Well, based on the studies, it doesn't really seem that way. For one, a lot of these fruits have a lot of fiber in them. And there are studies that show that when foods have a lot of fiber, like even like whole grains, they will cause cavities a ton less than things that are more refined and don't have a lot of fiber. And with fruits, it seems like the good stuff in them actually overpowers the bad, so they can actually help prevent cavities. cavities. Now, the last thing I want you to add to your diet are dairy products. Like cheese, for example, is a big one because cheese has a lot of calcium and phosphorus, which again, we know is important for remineralizing our teeth. And also, last point I want to make is make sure you're drinking plenty of water. When it comes to the best drink for your teeth, by far the best one is water because it's a neutral pH. Sometimes you can even get an alkaline water, but pretty much any other drink like coffee, tea, soda, even the diet sodas are really acidic. And they can lower the pH in your mouth, which they might not directly cause cavities, but they can help contribute to them because if your enamel's already at a lower pH, then you're going to be at a disadvantage when it comes to the sugary or carbohydrate foods that you eat, which will cause more acids in your mouth. Also, when you stay hydrated, it means you'll have enough saliva. Your saliva is really important for your teeth and gums because it kind of acts like a natural bodyguard for your teeth. It has a lot of antibacterial properties, and it can also wash away a lot of the plaque and bacteria in your mouth. And it can also buffer out the pH in your mouth and make it more of a neutral pH. Now, when it comes to saving money on actual dental treatment, this is when it gets a little tricky. There's still some ways I'm going to talk about, but at the end of the day, if you need treatment, then there's no real way of getting around it. Now, I'll start by talking about if you have dental insurance. If you have insurance, make sure you look at the terms and see exactly what is covered and if there's any waiting periods. Sometimes people will opt into an insurance because they want to get, let's say, a dental implant because they're missing a tooth. But then you might find out that that insurance has like a year waiting period. So you're going to end up paying for that implant out of pocket if you don't finish that waiting period. So make sure you look at the terms of your actual insurance plan. Also, some things are still covered at 100% that can prevent issues down the road. Like a really common one is a bite splint or a night guard. These are really good for preventing cracked teeth, especially if you grind or clench your teeth at night. Sometimes you might not even realize it, which is also another important aspect of going to the dentist because they can check and see if there's signs that you're grinding your teeth at night. But if you do this, then you risk wearing your teeth down and also chipping or cracking your teeth. So if your dentist mentions to you that it looks like you're grinding your teeth, and it turns out that you have 100% coverage on a night guard, then you should definitely go for it because that's a simple way to prevent issues down the road. A night guard is basically this thicker plastic retainer that you wear just on one arch, either your upper or your lower arch. And instead of grinding and wearing away your teeth, it kind of deflects those forces so that you don't put any strain on your teeth. The problem with a lot of insurance companies, though, is the maximum, like I said, is super low for a lot of them. So if you need a ton of work, like 20 fillings or like 5 crowns and like 5 root canals, but your maximum is only set at $1,000, that's not even gonna cover one tooth to save. In an ideal world, you'd get everything done as fast as possible because let's say you have a cavity on a tooth, the longer you wait, the more it's gonna spread and risk leading to a possible infection or a lot of pain or other issues. But if you're really tight on money, then you wanna start with the most urgent issues first. So these are gonna be any areas that are in a lot of pain or infected, or areas that might potentially lead to a bigger issue. Like if you have a really big cavity, but it's not really bothering you, but it might end up needing a root canal if you wait too long, then you definitely want to start there. This is where you can start to save a lot of money, even though you're spending a lot of money on the fillings. Because if you have, let's say, a big cavity and you address it early enough so that you don't even end up needing a root canal, you just need a bigger filling, a bigger filling is the same price as a small filling as long as it's the same surfaces. For example, there's a procedure called a DO, or distal occlusal filling. Essentially, that means that you have a cavity that is in between the teeth. And specifically, it's on the back part of the tooth because it's called the distal. But when you have a cavity that's in between the teeth, then you have to go from the biting surface of that tooth to access that cavity. The biting surface is called the occlusal, so that's how you get that distal occlusal part. Sometimes this can be a really tiny cavity and you don't need to remove that much tooth structure. But sometimes it can be really big and you have to remove a lot more tooth structure, but you can still just keep it as a DO. Either way, they cost the same amount. But if this cavity gets really big and ends up getting into the nerve inside your tooth, now you're gonna need a root canal and probably a crown. Now, both of these are gonna be way more expensive. And this is when you can eat up all your insurance money just working on one tooth. Then if you have to wait for a whole year before your insurance renews to tackle your other teeth, now you risk your other teeth, those cavities getting bigger and also causing problems. If you take on the urgent areas first and the rest of the areas are small, then you might be okay waiting a little bit. It's not ideal, but if you're really tight on money, then I would definitely start with those urgent areas first. Unfortunately, if you are in a situation where you need a ton of work done to save your teeth, then your options are really limited. And if everything is urgent at once, then this can get really overwhelming. Some offices do have payment plans that you can look into to help out, but really the only option you have at this point is getting the work done if you want to save your teeth. All right, guys, I hope you liked that video and I hope it was helpful. If you have any questions or want me to make any other content, make sure you let me know in the comment section below, and make sure you hit that thumbs up button and subscribe while you're down there. Did you know that some of the dental advice you've been following for years might actually be wrong? Today, we're gonna debunk 6 major myths about your dental health that might be ruining your smile. And if you think that you're safe because your teeth don't hurt, well, think again. So make sure you stick around for the full video to hear all the tips to keep you away from the dentist, at least more than